A 21-year-old Caucasian female named Samantha Smith lost control of her car and crashed into a tree. The patient's sister witnessed the injury as she was the passenger in the patient's car. The sister states that the patient wasn't wearing her seatbelt. Upon impact, the patient went over the steering wheel and hit her head on the windshield. She currently complains of head pain and appears somewhat confused immediately following the accident. The patient's sister called 911, and a few minutes later, EMS arrived on the scene. The patient was examined immediately upon arrival by the EMS. The patient is currently alert oriented times 3. Her vital signs are as follows: temperature 97.9, blood pressure 138/84, heart rate 130, respirations 24, and her pulse ox is 94% on room air. Her pain is rated 7 out of 10. Her skin is hot, dry, and flushed. There are no visible contusions, edema, or blood noticed. Pupils are equal and reactive to light. The EMS places a neck collar on the patient and places her on a backboard. She is transported to the nearest emergency department. Hi there.
Hi.
I'm Ashley. I'm going to be your nurse today.
Hi, my name is Liliana. I'm going to be your PCT.
Okay, can you get a set of vitals on her for me, please? Okay, perfect. So your name is Samantha Smith, is that right?
Mm-hmm.
Okay, and you were in a car accident today?
Mm-hmm.
Okay. From what I understand, for your history, you have migraines?
Yeah.
Okay. Are you having any pain right now?
Like a really bad headache.
Okay. And then who is this here with you today?
Well, this is my sister.
Oh,
This is Kara.
Hi, Kara. Do you mind if she's in the room with you?
Oh, no, yeah. She's
Okay.
good.
All right.
I'm actually gonna take this phone call.
Are you sure?
Yeah, it's just taking so long.
Okay. So you have a family history of hypertension and diabetes. And then let's see, anything else that you want to add there? You have a history, or you have a latex allergy, so we have this band on for you, so we don't use any latex products, okay? So right now what I'm going to do is listen to your lungs and everything. Is there anything else that's bothering you, or do you have any nausea, or do you feel like you're going to be sick or anything like that?
My stomach's a little upset. And that's really it. Yeah, I've been having like a little bit hard time breathing. That's really it.
Okay, and then do you know how you got here today?
Ambulance.
Okay, and do you know the year?
2014.
Okay. Who's our president?
Obama.
Obama, okay. I'm just going to listen to your lungs really quick and your heart, okay?
Okay.
Okay, another deep breath. Another deep breath. Another deep breath. Listen to your heart. Okay, sounds good. Can you tell me what her vitals were?
Yes, her temperature is 98.6, respiration rate is 22, heart rate is 60,
Okay.
blood pressure is 144/90, and O2 sats are 91%.
Okay, thank you. All right, I'm just waiting for the doctor to come in, okay?
Okay.
Oh, here he is.
Hello. Hi, Sam. Sam
Hi.
Smith. How are you?
Good, how are you?
I'm good. My name is Dr. Juan. I'll be your doctor today. I'll be taking care of you. What happened?
I was driving like a squirrel when it's in the road, so I swerved and there was a tree, so I hit it.
Okay, car accident. Did you hit your head?
Yeah, pretty bad.
Okay, did you lose any consciousness or?
I don't think so.
Okay, and your tooth, is that result of the accident?
Yeah.
Okay, all right. Nurse Ashley?
So this is Sam Smith. As she said, she was in a car accident today. She hit her head on impact. Right now, she has a history of migraines for which she takes Tylenol and Imitrex.
Okay.
Her vitals are pretty stable right now. Her blood pressure is a little high. Temp is 98.6. Respiration is 22. Her heart rate is 60. Blood pressure 144/90. And her oxygen is 91% on room air.
Okay.
My recommendation right now, I think, would just be to get a CT to see if there's any damage internally right now.
Yeah, we definitely want to see a head CT. Also, are you in pain right now?
Yeah.
Okay, how about we give you 1 milligram of Dilaudid?
I think it'd be a good idea to do 0.5 for starters, just at least until we get the CT results.
Okay, yeah, we can do that. We can do that. How about, are you nauseous or anything?
Yeah.
Okay,
Yeah.
we can give you 4 milligrams of Zofran, IV
Okay.
push. Also, I would like to have some blood work done. I'll have a CBC, BNP, PTT, INR, PT, type and screen, pregnancy test as well, and a drug screening as well.
Okay.
Okay.
Start that now.
Also, I see she came in with a bag of saline from the EMS. Let's continue
Yeah.
the saline drip.
Okay.
100 mLs an hour,
Okay.
normal saline, and because her pulse size is kind of low, I want to get her on nasal cannula. 4
Okay.
liters O2.
Okay.
Okay.
Sounds
Is there anything else?
Mm-mm.
Also monitor her nose and ears for any drainage. Okay.
Okay, sure.
Because it is a head trauma, we want to make
Yeah.
sure everything's okay. All
Okay.
right. All right, Sam. I'll be around. Need anything? We'll be here. If there's a call light, we'll take care of you. Okay.
Okay.
All right. Excuse me.
And then you'll enter those in the computer for me, please?
Yes, I will.
Okay,
I'll get
perfect.
it right now.
Thank you very
Step
much.
aside.
Yeah, it's me again. So what I'm gonna do, I'm gonna give you the Zofran like the doctor ordered, okay? 1 milligram of Zofran, that's gonna help with your nausea, okay? So can you just tell me your name and date of birth?
Samantha Smith, July 1st, 1990.
Okay, good. And then we got your oxygen started for you as well, so hopefully your oxygen will go back up there for you. So I'm just going to wash my hands really quick.
Are you guys David?
Are you still having pain?
Yeah, my head is killing me.
Okay. Can you rate it again on that scale, 0 to 10?
It's like, yeah, it's like an 8.
An 8, okay.
He's like, it's like crazy. It hurts really bad.
Okay, I can try dimming the lights too to see if that helps. And then I'm also going to give you the Dilaudid before you go to CT to help with your pain as well, okay?
Okay.
And they're going to come in pretty quick to take you there. Scrape that off. And then it takes about like 2 to 3 minutes for it to go all the way through, okay?
Mm-hmm.
Okay, so this just has to be pushed over 2 to 3 minutes, okay?
Okay.
All right, that was a fast 3 minutes, huh?
Yeah.
Okay. Do you feel better at all, like your nausea?
Mm-hmm.
Okay, good. All right, so I'm gonna go get the Dilaudid. It was just being sent up from pharmacy, and then I will get that too to help you with your pain again. Then we'll bring you to CT, okay?
Okay.
Is there anything I can get for you right now?
No, I'm good.
Okay, and then your call light is right under your sheet right here. So don't lift your head up,
Oh, sorry.
whatever you do. Okay, so I'll be back in just
Do you know where
a
my
minute.
sister went?
I think I just saw her smoking outside. So, yeah, so
Okay.
hopefully she'll come back up and stay with you a little bit, okay?
All right, thank you.
All right, you're welcome.
The nurse enters the patient's room and finds that her status has drastically deteriorated. The patient has an ANO of 0, her Glasgow Coma Scale has dropped from a 15 to a 6, her vital signs are as followed: respirations 12, heart rate 40, BP 170 over 100, oxygen saturation 88%. The physician is notified and the patient is immediately brought back for a CT of her head. The patient's CT scan reveals an epidural hematoma and she will undergo an emergency craniotomy immediately.
Hi, Dr. Wan. The patient's all prepped for her craniotomy.
It's a beautiful day to save lives.
The patient was in the ICU for 2 weeks after surgery with an ICP monitor in place. While in the ICU, the nursing care interventions included the following. These nursing interventions paid off. Eventually, the ICP monitor was removed after the patient's health status improved. After 2 weeks in ICU, the patient was transferred to the neuro step-down unit. The patient continued to gradually improve. After 3 days on the neuro step-down floor, the patient is ready to be discharged home.
Hi, Sam. Okay, so you're going to be discharged today. I already met your sister, Kara. Hi. So with activities, no extraneous activities. Please confirm with your doctor. Call him about like 1 or 2 weeks. Follow up with that. With incision care, you want to keep it dry. No creams, no lotions. Please make sure use antibacterial dial and no baths until it's cleared by your doctor. If you have any neural changes like dizziness, confusion, nausea, vomiting, please call your doctor right away. You're going to be on Dilantin, which is an anti-seizure medication. It's to prevent any seizures from happening. You may or may not have any seizures. Hopefully you don't, but that's to prevent it. I know this is going to be difficult for a couple of months. It may be frustrating to deal with everything that's going on, so I can refer any like support groups or counseling if you need. And also, the last thing, seatbelt. You make sure you wear your seatbelt, please. We don't want to see you back here again.
Yeah.
So be careful, and also tell anyone who's in the car to wear their seatbelt too.
Okay.
Okay, so this is what I went over. If you want to sign, and you can just keep that for yourself.
All right,
If
thank
you have
you.
any more questions, you can call us, call your doctor. That's it. Do you have any more questions for me?
No, that's it.
When is her hair gonna grow back?
It could take a couple of months, depending how fast your hair grows.
Okay.
So, yeah, it may not take that long.
Okay.
They'll grow back.
All right, good.
All right. Well, it was nice meeting you.
You too.
All right. Bye.
Thank you. Let's go.
Following discharge, the patient was not receiving enough support at home from her sister. During the patient's follow-up appointment, she discussed her lack of support at home with the nurse. The nurse provided her with social services, community, and support group information. The patient joined Fulton County Brain Injury Support Group. She reports she is doing well and receiving adequate support. She also now always wears her seatbelt.